Hello, good evening. I am Mrs. Parul Chaya, Deputy Secretary General from the Association of Private Health Facilities of Tanzania. My apologies for talking in English. Last 2 days, we are talking about tax and investment policy reforms in our country in all sectors like transport, ICT, banking, tourism, agriculture, telephone, minerals, startup, etc., forgetting the most important sector, health. Health of our fellow countrymen. Without good health, all the sectors will collapse. None of us would be in this hall if we were not in good health. It is unfortunate that private health sector has not been invited in any panel discussions, which proves that health is a forgotten and neglected social sector in our country. Health is not a business, it is a service for calling. But unfortunately, we have been kept on the same footing as a profit-making business entity and not a social sector which saves human lives. Private health sector is in crisis. We pay 32 different types of taxes and fees. We need urgent intervention and separate audience with our Ministry of Finance and Ministry of Investment, along with our Ministry of Health, to rescue the private health sector. Without healthy citizens, the country cannot progress. We thank Her Excellency, the President of our country, Mama Samia Suluhu Hassan, for her encouragement to the private sector. We hope we shall be heard before we are forced to close down our facilities, which are not on oxygen, but actually in ICU on a ventilator. Private health sector is taking its last breath unless it's rescued immediately. Thank you so much for the chance to air our concerns. If you want to know the taxes paid by us, we pay corporate tax 30% on secondary employment, where there is 53% shortage of human resource for health as per strategic plan of the Ministry of Health, withholding tax 10% on rental, property tax, land rent tax, VAT 18% on some of the items, city service levy 0.3%, stamp duty tax 1%, import duty on some of the items, excise duty 10% on some items, rail duty 5% on importation, SDL 3.5%, 10% NSSF contribution, WCF 0.5%, business license, OSHA, fire, TBS, TFDA, insurance, NEMEC, Sumatra, ministry license fees, laboratory license fees, radiology license fees, private hospital advisory board fees, medical professional practice licensing fees, which is MCT, garbage collection, capital gain tax, fees, fines, penalties, and many more taxes, Dawasa, TANESCO, work permit, immigration, signboards, parking fees. So it's not possible to survive. The private sector is really collapsing. Thank you so much. Secondly, when we are talking about how do our country collect tax. So just an example, what we had in India a few years back, our Prime Minister came up with a scheme of voluntary disclosure, whereby the scheme would ensure that the rule relating to the economic offenses would not be applicable to those defaulters. And in 1 month, the government collected $980 million to the Indian Finance Ministry. So something we can think about it to have that type of thing in our country as well. And secondly, to promote Tanzania as a place of destination wedding, because most of the rich people across the world would go for a destination wedding, and there cannot be any other country than Tanzania for that. So we should promote tourism for destination wedding. Thank you.
Asante. Mama ameongea kwa lugha ambayo naamini wengi wetu tumeielewa kwa sababu tumepiga makofi. Na bila kurudia sana kile ambacho amekisema, lakini yeye anatoka sekta ya afya na ameeleza kwamba